name is J.C. Smith, and I have been with Dr. Rios since 2011. Basically, I'm dealing with diabetes type 2. I meet with Alix probably every 4 to 6 weeks. She looks at the daily log I keep of what my blood sugar readings are, and those have gotten better since I've started having interaction with Alix.
My primary role within our clinic with internal medicine is I'm the ambulatory care pharmacist. What that means is I work with our providers to provide direct patient care for chronic disease states, and in this case, JC. So after talking to him for a little bit, he kind of opened up to me, and what we found out is, diet could improve. We weren't exercising that much because we were in a little bit of pain, but we didn't have our medicines. We were rationing our insulin, and because he was rationing his insulin, he wasn't meeting his healthcare goal.
JC and I go way back, and he has several medical conditions that are complicated, and he required a more intense approach that I was able to offer him by myself. And all of us react to messages in a different way, so we need to fine-tune the message to really get to you to affect change and get you to understand why it is important that you do the things that we're recommending you to do. So that's where our team comes in, and our ambulatory pharmacist, Dr. Alix Schnibben, got a really good relationship with JC, talking to him frequently, seeing him frequently, going over his medications, going over his logs for his blood sugar, and really things started to change.
I feel that with Dr. Rios, as long as he's been my primary care physician, that he recognizes me as an individual. I'm not just another patient. Since I've dealt with Alix, not only has she checked on me in person, she has given me telephone calls to see how I'm doing, and you don't find that in the 21st century too often.
Part of an ambulatory care pharmacist is we live and breathe by our word. If I know a patient's going to need something, I'm going to stop everything and figure out what that need is. So if it's stopping to help him fill out medication access forms and then following up until it's at his doorstep, that's what it's going to take. And yes, I've been doing this for a while now for NGPG patients. I've only been here for 2 years. My team has grown from me to another pharmacist and now an ambulatory pharmacy technician. And so far, since October 1st of 2020, we have secured $2.5 million in free medications for our patients. So yes, we're going to keep doing it because it helps our patients meet their healthcare goals.
NGMC is the only group that I have dealt with since I contracted this diabetes. But I would not imagine that they would be outdone by any other group with what they have provided me with care.